much, Trevor. I'm going to be the first one to use this clicker, so I hope it works. Let's go for it. As mentioned, we're just going to take a quick look back at the first global conference. That was held in Paris, in the beautiful city of Paris. I took that photo. I'm on Instagram if you want to follow me. We had an opportunity to hold this first global conference with over 300 participants from all over the world and from 80 nations, all of whom were concerned, or still are, concerned with biological threats. And what did we mean by biological threats? For this particular conference, we broke it down into two categories: the known, the naturally occurring, and the unknown, to try to fit it all in there: the emerging, the accidental, the deliberate, the disaster-related occurrences. From the animal health perspective, one of the main drivers for this global conference was to put biological threats squarely on the agendas of our OIE membership. Even though naturally occurring events are the most common, they still have the greatest impact worldwide. But this first conference was a real, opportunity for awareness raising around potential threats related to accidental or deliberate releases of pathogens, as well as to strengthen those links between the health and the security and the law enforcement sectors. It was a unique opportunity for that. So after 3 days of discussions, we had over 40 speakers and 30 poster presentations. We ended up with 18 recommendations, and that seems like an awful lot, right? But they were developed and they were agreed upon by the participants to the conference. For the most part, our reason for having recommendations is that we have a strategy and a plan going forward, and they're very much related to the OIE's mandate and its future activities. And these recommendations really form the basis of how we might move forward together, either as an organization or with our partners. So the 18 recommendations, I'll talk to what OIE has done for the most part. And one of the first recommendations was really a call to action for us to collaborate even more. And we have certainly undertaken some activities in collaboration with some international organizations, with our colleagues in FAO, WHO, Interpol, UNICRI, and UNODA, just to name a few key international organizations. That was the spirit of recommendation number 8. It was to expand and deepen our collaboration with other international organizations that also work and care about reducing biological threats. Our joint efforts are really much more fruitful, and in terms of leveraging the expertise that these other organizations have that we might not have within our own. An example of that is from recommendation number 4. One of the things that we talked about this morning with the panel that we had was that simulation exercises are really quite important to undertake at the national or at a regional level. So we worked with our colleagues in Interpol, and my colleague Mariano and my colleague Alexander Hamilton and others are in the audience, put together a regional tabletop exercise with Middle East and North African nations, and thank you to our regional and sub-regional representations with helping us with that. There is going to be a side event on the last day that I encourage you to participate in. That Mariano and our colleagues from UNICRI will be giving a presentation. They'll go through the recommendations and the lessons learned from simulation exercises. I think there was quite a lot learned, and there's quite a lot to build on as a result. Then, as a standard-setting organization, OIE took on recommendations 9 and 10. And this was really about developing guidance on methodologies of undertaking investigations of suspicious biological events. Say that quickly 10 times. There was an ad hoc group that was set up in July 2017 we had a lot of distinguished experts from the security sector, from the health sector, and from the law enforcement sector. And there's a poster outside that tells you a little bit about that. Our colleagues, Christine Uhlenhout and Mariana Marana, were running that ad hoc group, and there's a little bit more information on the poster. I think, if I remember, poster number 34. So you'll learn more about the experts involved with that activity. Recommendation number 13. This is the work that we're doing with our colleagues in FAO to reduce rinderpest, virus-containing materials in laboratories. We've done a lot of work over the last several years, and we've worked with member countries through advocacy meetings that were organized by FAO, and we're encouraging countries to take action to destroy this material or to sequester it in one of the 5 rinderpest holding facilities that we have across the globe. And you'll learn more about the rinderpest post-eradication activities that will be given in a presentation later on in this conference by our esteemed chair of the Joint Advisory Committee during the 8th plenary session. Then, recommendation 16. This was some work that was done through our Veterinary Legislation Support Program. This is around awareness of national veterinary services of having their appropriate legislation to act effectively and efficiently in the face of biological threats. And you'll hear more about this initiative from our colleague David Sherman on the Veterinary Legislation Support Program, and by Dr. Lisette Gomez-Rodriguez on the Dominican Republic's experience with veterinary legislation and biological threat reduction. Pardon me. And then finally, recommendation 18, your second global conference. You're welcome. This couldn't have been done without the support from our colleagues within the public health, security, and disaster risk reduction communities to hold this conference. It builds on the cooperation and engagement that we have established since the first conference. And to achieve this recommendation, there's a lot of work that goes into putting together these global conferences, but I do want to recognize the scientific committee and the energy and the thoughts that they brought into developing this program that you're going to experience over the next 3 days. There was 5 different time zones in which we had to work. So you can imagine, going across the globe, some people just getting up in the morning and some people just going to bed. But we thank you very much for your participation and your hard work in putting together this program. So I'm only mentioning the OIE at this time, but there is a lot of other work, and sorry, just one moment. There is a lot of other activities that have gone on. I'm not going to go through all 18 recommendations. That would just be painful for everybody. But taking into consideration that the main drivers and the recommendations for the global conference and for the second conference, we have achieved quite a lot in terms of addressing the threats from the deliberate or accidental category. So part of our commitment at the OIE is the development of the strategy, and this was mentioned by our president this morning. So our commitment really is about preserving and protecting animals and preserving our future. But this reference document for us in terms of biological threat reduction is very much closely linked to our 6th strategic plan and supportive to the mandate that we have to improve animal health and welfare worldwide. It's our policy document. It's a basis of our engagement with partners and stakeholders to implement certain activities and for strengthening and enhancing health systems. The OIE's view is that the effective and sustainable way to protect against threats from deliberate and accidental releases of animal pathogens is the same for naturally occurring events. namely to strengthen existing systems for surveillance, early on-farm detection, rapid response, and for biosafety and biosecurity, to foster scientific networks that we all work towards altruistic goals. Our vision is that a world that is safe and secure from accidental or deliberate release of animal pathogens, including zoonoses. One of the other things that we try to focus on as well in terms of this improving animal health and welfare is that regardless of the origin of the disease, in other words, if it's natural, accidental, or deliberate, you know that something's wrong. You can't necessarily tell that it's deliberate or it's accidental. You just know there's something amiss. And there's no point in wasting time trying to figure out what it is or what it isn't. You need to deal with it. When something occurs, your best hope is to quickly put in the measures in place to control or to stop the spread of the outbreak. And your speed of your reaction time for putting in measures in place is essential. And of course, the authority to put those measures into place is also essential. You can assume it's deliberate. It doesn't really matter. The control measures, the authorities that support those measures, and the investigation probably wouldn't be any different if you assumed it was natural. With that said, please take this opportunity to speak with experts and colleagues and talk to them, those that are presenting on the posters and those speakers that you'll see during the course of the next 3 days. And to reiterate our OIE president, we want you to actively participate. In the panel discussions, as was discussed by our facilitator, Julie, you have the opportunity to pose questions as we go along through the Poll Everywhere. And that will help us also to develop the recommendations. And we'll do our best to keep it under 18 recommendations. Thank you very much for your attention.